wanted to create a model that promotes transparency in what you're paying for. Meaning, as somebody who lives abroad but sponsoring your loved one's care, we have a model now that puts you in a place that you get to see everything that's going on. It's outcomes based practice in the sense that every single dollar there's something measurable that you could get out of it. So for somebody who has diabetes, for example, just getting medications on a day-to-day basis, it's not good enough, right? The IGH way is, yes, getting quality medications, because we know that's a problem not only in the Gambia but the entire continent, but also introducing electronic health record system as the standard is something that now creates a level of accountability. It creates a level of continuity of care. So every single point of the patient's care, there's enough information to assess how well somebody is doing. So how healthy is somebody's doing. So I think for every Gambian who lives abroad, IGH is positioned to be the one company that could give you a peace of mind when it comes to taking care of the health of your loved ones. Our mission is to make sure that less Gambians are having to find ways to leave the Gambia to receive treatment when there's Gambians who are equally qualified who could now offer treatment in the Gambia. Right? So our Wellness on Wheels, our WOW delivery program, for example, now not only are we creating access for a country, but from Banjul to Basse, we could now make sure that if you have a loved one who lives in the Gambia, they could receive quality medications, they could get access to qualified technicians, qualified pharmacists, but also things that go along with managing their disease like their education, their point of care testing, you have access to it. So now for somebody in the diaspora, technology has made our world easier. Now is the time where we leverage it as Gambians to make sure it works for us. So as somebody in the diaspora using our mobile application now, you basically have access to exactly how well your loved one is doing, right? So it creates a level of transparency, but it opens it up where every single person has access to almost send a gift of health to somebody back home. But internally too, we don't want to exclude Gambians who live in the Gambia. They have equal access to these services as well too. So our biggest priority now is partnering with stakeholders in the country. The Ministry of Health, there's potential partnerships there, private businesses. We want to create almost champion a new way of approaching healthcare, where it's all inclusive. It promotes a lot of awareness. It changes the culture. But not only that, once we create the model in the Gambia, how do we replicate this model everywhere in Africa? Mm-hmm. So our model it's starting in the Gambia, but it's something that there's an abundance of African healthcare professionals in the United States and in Europe. So we built Innovrix Global Health in a way that everything that we do in one country, we could replicate it. Because diabetes does not discriminate based on what country you're from. So most of the challenges in terms of drug supply chain systems, most of the challenges in terms of access to quality care, it's not a Gambia problem, it's an Africa problem. So that's where I feel like the company is positioned in a way to be that agent of change on the continent that a lot of people could benefit from. So our mobile application, IGH WOW, it's going to be on all platforms. So Google Play, Apple Store. The link to download it, it's on our Facebook page as well too. So it's readily accessible. And our mobile application is very user-friendly. So once you download, if it's only requesting a service, because we do have a retail section as well too, as part of IGH Community Pharmacy, where we sell a lot of vitamins, supplements, cough and cold products, feminine hygiene products, men's health products. All these products we are sourcing from the US because we could guarantee the quality of it. So that's readily available through our mobile application too, because we want to also make it known that the company is not only designed for somebody who has a chronic condition. IGH is a healthcare solutions company, and prevention is very much part of healthcare in terms of what lifestyle habits are, recommended for healthy individuals to stay on top of their health. So it's all inclusive. So the service the mobile application almost acts like a one-stop shop to get a lot of the features that the company could offer. I think for me, Innovarix Global Health has always been bigger than healthcare, right? Um, Obviously, I've spent more than half of my life not in the Gambia, right? I've been privileged to have a good quality education, to have a skill set, but my subconscious has always reminded me that there's people who need more of what I do on the continent, which has always been the driving force to create something sustainable that I could proudly take back home instead of always being in the diaspora pointing fingers back home about what's not right. So my hope is it could spark something in any individual who is qualified or has a skill set um, that they could take back home because our people need it. I think the responsibility is not on us, right? Our generation, especially anybody in their 30s right now, we're at a point where we can't yell and scream about how the elderly generation are not including us in national development when we're actually not willing to sacrifice to kind of be in the arena and start planting seeds of something that could make the continent better. So that's the whole concept where you breed a new generation that hopefully will spark more people to take ideas back home. And that's why I'm always willing to collaborate with any young Gambian, any Gambian who's interested in moving the country forward in terms of healthcare, education. I think there's a way that Innovarix could have some kind of cohesion with them.
So summarize to me why I, as a customer, potential customer, needs to buy into the IGH way.
I think the biggest value for customers when it comes to IGH is one, leveling the playing field in terms of access to care, but also giving you a peace of mind knowing that now there is a way for your loved one to get better. There is a way for their quality of life to improve because they have access to the right type of medications, they have access to the right type of care, they have access to the right clinical foundation. But most importantly, too, there's less of a burden now for you to always see taking your loved one out of the Gambia as the only way to ensure that they'll receive quality care, right? So it's understated a lot of times how much burden that puts on somebody who lives in the diaspora, having to constantly worry about how fragile or unstable their loved one back home because of a chronic condition that in 2019 should be something they could live comfortably with provided they have access to the right care. So IGH is representing that bridge, that gateway. It's representing that value proposition to patients where now there's an opportunity to make sure that even Gambians in the Gambia, even Africans on the continent have access to the same level of care than anybody else living in the world.